So that's when I took her under my wings, and I said, "You're my baby." Yeah, it was a lot.
So what we do in public health, we really focus in on prevention and outreach to communities and thinking about what's happening at the population level.
Public health, like as a field, is about all those supportive services that kind of wrap around a person in order to make sure they're able to want to get medical care.
We have to think about what makes it so people don't get access to treatment, and socioeconomic status and housing and not having childcare and not having transportation to get to appointments. So all of those big social determinants of health, that's the work of public health.
For HIV services and STI services, there's tons of resources throughout the city of Boston that you can get care for free or very low cost, even if you don't have insurance at all, even if you're undocumented, even if you are homeless, don't have a job, anything. Yeah.
Go Boston.
Yeah. Within Victory programs, we have support with housing search and housing assistance and rental assistance, utility assistance.
Yes.
And supportive services.
I never pay for any HIV medications.
For me, I literally cried when they approved me for insurance here, because they always say, like, you don't even have to pay your copayment, but it's actually completely free for me. And in my home country, I couldn't afford it. It was too expensive.
The 2 days before I got diagnosed, I lost insurance at my job. I was like, I can't afford it, I'm gonna go bankrupt. So yes, we do not turn down anybody in the city of Boston. If you walk into a hospital, no, we will help you.
Documented or not.
Yep.
Yep.
Some folks are in denial because then it becomes real. Then I'm a statistic.
When I was a case manager, I never forget, this lady would not tell anybody in her family because she was scared that her family would take her children away.
There are trans folks who may not be able to have access to health insurance. They might not be able to get to a clinic because they can't afford it, right? And then it becomes like this cycle where like they don't have a job, so they don't get health insurance. Because they don't have a job, they're like either homeless or unstably housed. So there's like so many different barriers that are put against trans folks.
We see a lot of domestically violent relationships, so mixed status couples where one partner is afraid to disclose their status due to fear of physical retaliation.
There's a lot of that, you know. So I work at Codman Square Health Center, and there was a newly diagnosed young lady that came in. She told me that no one knew that she was infected. She wasn't going to tell anyone because her family would deny her. It was a lot.
There's laws that prevent providers for disclosing your status.
Yeah, no, there's HIPAA for a reason.
Period.
Period.
From my infectologist, when I got diagnosed, he told me, well, you have just ruined your life. I was 18-year-old, and I was just like, thank you.
I had thought that maybe I was exposed or there was a potential risk of like an STI, and the provider said, well, at some point, it's on you to take care of yourself, you know? So the sex shaming was real in that moment.
It's important that we all know and we share with others that doctors have a responsibility to treat you like a human. Doctors have a responsibility to your health care, to listen to you. And if it's not, you have every right to change providers and see a different doctor. And that's really important.
Often the stigma around HIV means people don't feel comfortable disclosing, or they do disclose and then they get a negative reaction and they don't really get the support that they deserve. I think there's probably a couple things going on. I think one is sometimes providers can be a little bit paternalistic and think it's their role to make decisions for other people. But another thing I think is that in our medical training, we're just taught a lot about how all the bad things sex can cause, right? All of the sexually transmitted infections, and I think we're not really taught a lot about how a happy and healthy sex life is an important part of people's overall health and thriving for some people.
Boston Public Health Commission we're really focusing on intentional efforts to reduce stigma both internally and externally. Internally, we are working on institutionalizing stigma reduction and how can we work together to address those stigmas in our own roles in a more cohesive way so that we can actually measure our impact in our communities. And then externally, we're really trying to focus on building those community partnerships with organizations who are already on the ground, who already have built relationships with people in the community.
For myself as a queer woman, I've had to advocate to get HIV testing because people don't perceive me to be at any risk. And there's just a lack of awareness about how HIV can affect anybody, I think.
I just had a doctor's appointment for a regular checkup, and it was the first time in my chart that it came up, you're due for your regular HIV screening or Hep C screening. I'm like, this is the first time I've ever seen this. Why isn't this normalized?
Women have always been behind in terms of how we incorporate them, how we include them in our work, whether it be from clinical trials and in just the work that we're doing, thinking about how we best provide care and treatment for women who are living with HIV or at risk for HIV.
The same way dating, you may have to go on a lot of dates before you find the one. The same might be true with your doctor. And so, and that's okay. It's okay to say, I want to find someone who's a better fit for me.
Have that conversation with as many providers as you want. There's no wrong amount of times until you're comfortable that you feel like you have the knowledge.
When I'm going to the doctors, I'm paying for service, okay? And as I told the doctor once, you ain't give me my money's worth.
Having more youth centers that are also youth-led is helpful. Having young people teach other young people about this is the best way for them to learn because there are people who are educating you, but they're also my friends and my peers, sort of thing.
The reason good sex education helps is because it opens conversations about safer sex practices, about prevention methods, particularly when it comes from a place of not stigmatizing HIV status and other STDs, because then that increases the likelihood that someone will get tested as well, because it becomes like a routine part of sexual health.
There's no such thing as too much sex ed.
We educate people about having diabetes, having high blood pressure, normalizing it, making it a normal thing we educate people about, and how to take care of themselves.
Follower that was saying thank you for your post because you encouraged me to finally open up with my family.
We need to talk about sex and drug use with everybody, with all of the people who we encounter in our jobs.
Boston definitely has your back. Boston is providing resources and opportunities for you to take the best care for yourself.